Okay. Well, first of all, thanks, Paul, for joining our Amiculum Meets session today. The plan is, and the aim is to talk about AI adoption in the context of healthcare communications. And we know that there's an awful lot happening. It's a busy space. There's a lot of hype, a lot of noise, but there's also some amazing and really interesting developments that we can see right now. So I'm Steve Wilson. I'm heading up the AI and digital engagement function here at Amiculum. And that means at the moment I'm working across our business, working with our internal digital and tech teams, and also working with our external tech and AI platform stakeholders as well. So perhaps, Paul, do you want to sort of do a little intro as well in terms of what you're doing at the moment and what really interests you with technology currently?
Thanks, Steve, and pleasure to be with you on this talk. I think our main challenge is there's a lot to talk about, fitting it into a short space of time. So, for people that don't know me, my background is 25 years in content communications in the pharma industry. People may know me from Pharma Forum, the publication that I set up. I've worked agency side. What I'm currently now doing is leading View AI. We are an AI startup, as the name would suggest, and we are transforming the content process within pharma to really enable them to do the kind of modern marketing, bite-sized, personalized, relevant engagement that needs to be done in today's day and age. So AI is a hot topic, as you outlined, a lot we can go over. Let's try and touch on some of the more important aspects and cut through the noise.
Thanks very much, Paul, for that intro. Before we dive into what will be quite a bit of detail, I thought we could sort of almost pan out a little bit and set the scene and think about, where is pharma currently on this road to, dare we say, optimal AI adoption. And I guess, um, why should pharma be adopting AI right now? What's the sense of urgency? So I don't know if we could start with that and get some of your thoughts on that.
Yeah, I think maybe to start with the second piece, which I think is fairly straightforward, is whatever people feel about AI, and I know there is in some areas fear of AI, there's uncertainty, all those kind of things, but it's here. Pandora's box has been opened, it's here to stay.
Mm. Yeah.
And it's clear it can drive, efficiencies and better ways of doing things. And I think the companies that don't lean into that and start deploying AI are going to find they're at a big disadvantage. And I think if we look more broadly at where the industry is, and I'm always an optimist on these things, I
Mm.
feel like we're really coming to, if people know the Gartner hype cycle, the kind of slope of enlightenment. We've done lots of stuff with AI, lots of pilots across lots of different areas.
Mm.
And I think within pharma now, there is a real understanding of where it can genuinely add value and how to scale that within those organizations. So it's more focused and it's really tackling some of the real problems, which is the right way to do it. So I think we're in a good place as an industry.
Yeah, and I agree that maybe 2 years ago, a year ago, it was kind of hype mode, and I think now people are more focused on the practical challenges and issues and
Yeah.
where AI can fit into that, rather than just racing into doing something with AI because everyone else, what you feel that everyone else is, and perhaps that's not quite the case. And now, I think now people are looking at it more rationally, perhaps.
Point is you have to go through that period of playing around with it just to get people familiar. And some companies are still
Yeah,
doing that, and that's fine.
yeah,
But I think it then moves on to, a couple of really interesting stages. One is how can we look at current processes?
yeah.
And obviously, we're focused here on the kind of communications side, but it's relevant across the industry. How can we
Mm.
look at current processes and make things more efficient? But also, where it gets really interesting is how can you reimagine those processes? How can you think about completely different ways of doing things that are
Yeah.
powered by AI?
And what could be the benefits if we think about pharma brands, the benefits for those currently on market brands, and of course, new launches, those new products? What do you see as the potential there?
Yeah, so if we start off by just framing where I think AI brings an advantage in communications,
Mm.
and I'll start out by just addressing perhaps one of the fear factors on the head, which is, creative folks and agencies going, is AI going to take our jobs? And the answer is very clearly no, because I don't think AI
Mm.
can do that level of creativity, positioning, the skill of the human being. Where I think AI is really useful and important in communications is taking that narrative, that messaging, that positioning, and allowing companies to scale that to all of the content they need across all of the channels,
Yeah.
all of the personas, all the different stages of the journey, which, as I touched on before, is the way we engage in other sectors. You think about channels like Amazon, they know just what to tell you at exactly the
Yeah.
right point at the right time. And that within the sort of current systems of
Mm.
developing content, time and materials, and then going through the approval process that we all know and love, it's impossible to do.
Yeah.
So by taking those starting materials and using AI to accelerate approval, to accelerate creation, to enable personalization, you can do content at a scale and a dynamism that you can't without that. Now, to your point about where with the brands that makes an impact, then yes, there's a clear benefit for
Mm.
later stage lifecycle brands where it becomes more digital engagement, need for that volume of content.
Yeah.
But I also get really excited about what this can do for launch brands because studies repeatedly show the first 12 months of a launch brand dictates your trajectory for the whole life cycle.
Yeah.
So if you need to change something in that first 12 months, you've got to be really quick about changing your content and your messaging. And again, that's hard within the current processes. AI gives you an agility that means you can do that.
I guess that sort of takes us maybe a little bit more into pharma workflows as well. And I
Yeah.
wondered if we talk a little bit about where can AI most effectively enhance pharma workflows, or another way of saying this is where are those pain points in terms of content, if that's where we are at the moment. And again, Paul, I know this is an area that you've worked in for quite some time, so I'd be interested to get your thoughts on this.
Yeah, and the obvious sort of low-hanging fruit is not always the most exciting things. And in fact, I think the early applications of AI are in the areas that, quite frankly, is work that human beings don't like doing too much.
Yeah.
So take a look at approval and the approval process that we all know. The content has to be screened to make sure it's compliant. That's about checking the medical accuracy and it's about checking the regulatory compliance.
Mm.
That currently involves senior people within pharma companies spending hours upon hours eyeballing documents, checking whether they're valid or not, reviewers doing the same, often also external agencies, whether they are comms agencies or specialized review agencies. There's so much time goes into that. And I would argue that none of the people involved in that process really wants to be doing that kind of stuff.
Mm.
They want to be involved in areas where it needs that experience and judgment, which is some of those components, but not the vast majority, or being involved in the creative side. So that compliance process, I think, is one really obvious area. Equally, when you talk about content creation, what people
Mm.
get excited about in agencies is creating those new bits of content, that upfront creativity. They get less excited about, well, can you turn that into 10 different emails or can you make these small amends?
Yeah, yeah,
Again,
yeah.
these are the bits where AI can really accelerate things and kind of takes away some of the drudge work from the people involved.
We see that from our, from as a communications business, as an agency. Um, the view we have right now is that there's some significant opportunities to use AI to save time on some of the very laborious, very
Yeah,
important tasks around QC and the review process, where AI is a real assistant for the writers and the scientists and the strategists. It allows them to focus on sort of the more creative aspects of their role rather than being bogged down with some of the other more repetitive things. And yet there's still the human in the loop. It's not replacing what the teams are doing. It's just providing support actually. So
yeah,
that's starting to emerge a real opportunity.
yeah. And I think there's a really important point there, which touches on one of the fear factors, which is AI is going to take our jobs.
Yeah.
That's not what I'm hearing. I think companies that don't lean in and aren't using AI put themselves at
Mm.
risk because they won't be competitive, and that will cause job losses. But there's such a need for a greater volume of content that the agencies can spend more time up front on that creative process doing
Yeah.
that. And equally, AI with the review teams, if you can make it 10 times quicker, it's not going to be we need 1/10 of the number of people. It's great. We can get 10 times as much content through, which is exactly what we want to do.
Is there an obvious start point if for a pharma company or those involved in terms of how you get started with an AI application then for either medical, commercial, or compliance?
Yeah, I do think, and I'm biased because this is where we're focused, and we've
Mm,
just launched a product in this space. But I do think that medical accuracy within compliance,
mm,
logical place to start, because that is
mm,
where it's at least two-thirds of the work in the compliance process.
yeah,
The other third being the regulatory side, the local country nuances. But it's where a lot of time is spent just checking claims, references, those kind of things. And if you can accelerate that process, then that means, to what we described before, you can get more volume of content through more quickly. And actually, if you're doing that, you're already increasing content effectiveness because you have more of the bits that you need. So I think that's the real sort of block at the moment in the system before you can then move on to other areas.
that takes us on maybe into the next area that we were thinking about, and that is, well, what are those technologies? What can we use now? And we know that there are some exciting developments. Um, yeah, what would you say, Paul, in terms of the types of technology that are going to make sense in this case?
It's interesting as you look at the AI landscape, and we have discussions all the time. People tend to get really excited about the different models, are you
Mm,
using Gemini or OpenAI or whatever that may be.
mm,
And obviously, they need to be robust, they need to be secure. But actually, the way we're approaching this is you can try different models and work out what is more robust. I think the technologies that are more accessible have really thought about the kind of UX, the UI, how people engage with those, making them really, really easy to use. Because some of these things can be quite clunky, and you don't want to
yeah,
have to be
yeah,
trained in prompt engineering and that kind of stuff to use them. So keeping them really easy to use, but thinking about how they integrate into the current workflow. And it goes back to what I said before about there is a real opportunity to reimagine the process within pharma when it comes to content or other areas. But I don't think you can get there overnight. So the best technologies are really easy to use, fit into the workflow. And then as people start to get comfortable with them, then you can start to think about how we reimagine or re-engineer that overall process.
and on that point as well, I think often there's a focus on the technology, the core technology, whether it performs or not. But obviously, there's a lot of other factors to take into account in
Yeah.
terms of how an enterprise can get the best out of the technology, the user experience, this kind of thing. And I just wonder if you could talk a little bit from your experience of those aspects of product development as well, how important it is beyond the core technology.
Yeah, so I think two things are important there. One is to be clear on, as you start using these technologies,
Yeah.
what are you measuring? How are you assessing that they are
Mm.
successful? Now, to some degree, there's an element of internal user feedback. Do they enjoy using it? But if you look at slightly harder metrics and take the MLR compliance process as an
Yeah.
example,
Yeah.
speed is clearly one of those. Accuracy is critical because if stuff gets through quicker but it's not compliant, you've got big problems.
Yeah. Yeah.
But then you start to look at things like consistency. How can it provide a more consistent assessment of content than perhaps the human process right now? That's also critical. So set those KPIs, understand and measure those. That's key. But then I think at the point of trialing new technology, you have to think beyond that initial pilot.
Mm.
And I'm slightly averse to the word pilot anyway, because it kind of implies things that do a small project and don't go anywhere. And the reason why is
Yeah.
you need to think at the start about scalability, and that means how do you integrate into systems? Who are the stakeholders that you need on board to scale? How do you train people? How do you deal with the change management? A lot of stuff that goes beyond the actual technology itself.
Something, quite a hot topic for our clients being pharma companies is the question of should a pharma company invest and build their own platform, buy in? What's your thoughts on that?
We are laser focused on, we've got our first product out there. We're laser focused on forward features, the roadmap development.
Yeah.
Technology is perpetual beta. You're constantly iterating and updating. So I do have that bias, but that's why I also think it's not impossible for pharma companies to build these things, but it's not the route I would advise because if pharma companies want to build their own systems, they've either got to build their own AI teams, and I know just how competitive the landscape is for good AI engineers. They're very much in demand. or they work with external organizations who will build them bespoke systems, who will do a good job, I'm sure. But then you have the challenge of maintaining those systems, updating them. And at some point, normally in big pharma, the music stops and somebody goes, why are we spending all this money? But
Yeah.
the analogy to me is if you went to a pharma company or you're a CIO there and said, we're going to build our own version of Microsoft Office, the CEO would look at you like you'd gone crazy. Why? We'll use something off the shelf.
Yeah. Yeah.
So I think the same thing applies with some of these core technologies across the industries. I would say work with the companies who are laser focused on those areas, know the problem inside and out, and are constantly updating their products to make them better.
How do you um, set out a blueprint for success and support a much bigger level of adoption when you think about a new technology that could be very new?
So I touched on some of this before about the elements you
Yeah.
need to think about,
Yeah.
integration, having the right stakeholders, change management, scalability that's built in from the outset, not something that you think about after you've done that first
Mm.
project. But I also think it's about bringing the right players together. So take the example of us. We're a startup laser focus on technologies that transform that content process. We know about the change management side because of our prior experience. We know about the integration side, but we're not a change management consultancy. We're not an integration consultancy. So that's where working with the right partners that can come in and support that process and help scale. And obviously, it's part of the reason why we're working together, that
Yes.
can bring
Yeah.
those additional resources to bear. That's really important. And also, know what your focus is, because you look at these big pharma companies, they'll be built around Microsoft Azure or AWS or these big systems. We're not trying to be that. We know exactly what we're good at. We'll focus on that bit within the content process, and we'll link into those systems and make it really easy to do so. That's what gives scalability.
Leadership with this kind of project, where does that sit? Is obviously we would have a role in that, the farmer, client, customers, other stakeholders. If you had to sort of pinpoint leadership on something like this, where would that sit?
Yeah, great question. There's two levels really. So one is the people you're directly working with, and the starting point typically will
Mm.
be working within a specific brand or country. And you
Yeah.
need leaders within those functions who will support you, understand the problem, understand what you can do,
Mm.
will facilitate that project, will work with you to find the KPIs, etc. If you don't please those stakeholders, it won't work. They've got to love the product that you bring in. But I also think you need that senior level endorsement, somebody that is at senior global level, SVP, C
Yeah.
level,
Yeah.
who can see how this could transform at enterprise level and will be that advocate for that initial project. But then when they see the results, they see what it can do, can help and guide you in scaling within the organization. So you need both levels, senior endorsement, and you've got to really delight your stakeholders that you're working with on the ground.
Thanks very much for that, Paul. Are there any final thoughts and conclusions, particularly a message you could give teams um, who are feeling perhaps a little bit overwhelmed or uncertain because of the pace of change? Seemingly, like I said, there's a lot of noise out there. Is there a message for those that might be listening from you on that, Paul?
Yeah, and first of all, I understand the feeling of being overwhelmed. I think all of us kind of feel like we're running around. There's so much going on. So totally get that. And I think that makes it hard to focus sometimes beyond the day or the week that you're in. But I also think that AI used in the right way has the potential to break that cycle and give us some of that time back.
Mm.
And the only way to get there, to quote the phrase from Sheryl Sandberg, the COO of Facebook or former COO of Facebook, and she talks
Yeah,
about lean
yeah,
in. And she used it in the context of empowering women, lean into bigger roles and pursuing the things that you want to do. But it's true very much around AI. Lean in, embrace it within a safe way, working within your organizations. Take the time to understand where it can have impact, apply it to those areas, measure it, understand what works, and go on that journey. Because to go back to where we started, it's here. AI is here. It's going to keep transforming companies. And you can either get on that journey or you're going to find you get left behind. So just lean in and embrace it.
well, thank you very much, Paul. I really appreciate, given that you're very busy at the moment, your time on this discussion. And I think perhaps there's an opportunity to dig a bit deeper into some of the topics and the points we've discussed. But thank you very much.
Thanks so much, Steve. Really enjoyed it.